Maya.
Pharmacist and a registered nurse. So which one is your actual calling? Viewers out there, today we'll be talking about adherence and the importance of adherence. What is medication adherence?
So medication adherence in its simplest form is when you take your medications the right way, the right time, right directions, and with the right duration.
So what do you think are some of the reasons that patients will be not adherent? Because
okay, sure, but there are a lot of reasons that after talking to a lot of patients, you see, I see a lot of patients, not only in the hospital, I also see a lot of patients in our community, right? When you listen to their stories, it's because there's a common myth that one, they think once as they start feeling better, they don't need that medication anymore. So one, I would say, is ignorance, and two, another issue is them not being able to sit down with a professional to explain to them why they are taking those medications. People only take medication sometimes when they have the physical effect of the disease, right? When you are really sick, when you have a headache, when you have migraines, you're like, man, I need something. But what about your blood pressure when, even though your blood pressure is elevated, unless you start having those critical numbers, you will not feel it. That's why they call high blood pressure a silent killer, right? A silent killer because it will be eating up your veins, it will be dealing with you, but you will not know. So you don't take medications because you don't feel like, oh, that blood pressure is affecting me.
The consequences of not being adherent to your medication.
Increase in hospitalization, right? People end up going back to the hospital because they don't finish the course of the medications, or they end up getting sick, or they end up getting, the condition gets worse because they did not finish that medication.
But do you think there are any programs out there that helps people with the cost of medication to help people afford the medication?
Yeah.
And in terms of side effects, what should the patient do who is watching us having